Hello, everyone. And this week we will continue the Applied Medical Statistics playlist, which targets all practicing physicians, junior medical practitioners, medical students, and board exam takers. So, as I had been saying, this playlist will not provide a comprehensive statistical presentations. It's just a refresher for practical points that practicing physicians need. And we discuss the principal concepts and measurements, and we provide examples into how we apply this in the clinical practice. This week's presentation is about the number need to treat and number need to harm. So let's start. The number need to treat is defined as the number of patients who need to be treated with a particular intervention for one patient to benefit. So in other words, to prevent one additional adverse event. And as far as the interpretation of the number need to treat, the lower the number, the better the treatment or the more effective the treatment. And when we do the example, that might be clear more. So how do we calculate the number need to treat? As usual, we need the 2 by 2 table. So the equation for the number need to treat is 1 divided by the absolute risk reduction. And if you missed my video on the calculation of the absolute risk reduction, please review this playlist and you will find that presentation. But as a refresher, we said that the absolute risk reduction is calculated by subtracting the risk in the treatment group from the risk in the control group. So we start with the control group first. And in terms of calculations, it's C over C plus D minus A over A plus B. So let's do the example. This one says a clinical trial is testing a new drug in comparison to a placebo for treating a disease. The 2 by 2 table below shows the numbers of the study participants. What is the number need to treat? So in this example, they gave us the 2 by 2 table ready for us, which is make it way easier. But it's not always the case. Sometimes they will give you the scenario and you need to fill in the 2 by 2 table like we have done in our previous videos. But this one is ready-made for us. And I provided this example because sometimes in the examinations, you will find it like this. So if they give us the 2 by 2 table, we know the rule. We have to calculate the absolute risk reduction, and we just do 1 over that number. So in this scenario, let's calculate first the risk in the intervention group, which is A over A plus B, equivalent to 10 over 100, which is 0.1 or 10%. Same way, we'll do the risk in the control group, which is equal to C over C plus D, and that is 30 over 100, which is 0.3 or 30%. Then the next step, we calculate the absolute risk reduction, which is subtraction. 3.3 minus 0.1 equals to 0.2. The number need to treat is 1 over 0.2, which is 5. It's really easy and straightforward. Now, let's interpret. The interpretation of the number need to treat is as follows. We need to treat 5 patients with the new drug to prevent one additional case of the disease. The 5 is the product that we got after we divided 1 over 0.2, right? So that means we need to treat 5 patients in order to prevent just one additional case. And that is literally what we need to know if we have a new modality of treatment or a new intervention. So we compare it to the gold standard or to the practice that we are doing at the point to make our informed decision whether to implement the new intervention or to stick to our old standard. This is a way that we make our judgment. So if we are convinced that this number is good enough and the condition is serious and we want to prevent the harm by any ways, we can take this result. So from the beginning, we need to understand the current situation and how bad our condition at the moment to make our informed judgment. So, as I had been saying, this facilitates the evidence-based decision-making to choose what is the most effective intervention. So, the lower the number need to treat indicates the more effective the treatment. Because think about it. We just need to treat a few number of patients to prevent one new case. That means it's good. It's good because it's just a few patients will show some outcome from this intervention. But at the flip side of it, if we need to treat hundreds of patients just to achieve one improvement or just to achieve one prevention, it doesn't make a great deal for us. So this is how we make our judgment based on the number need to treat. Again, as I said, it depends on the baseline risk at the time being, at the time of the study, because sometimes we are in a situation we need anything that can improve the current situation. So it's important to consider the benefit and the harm when we make our informed decision and the evidence-based decision. So now we will talk about another concept interrelated to the number need to treat, which is the number need to harm. It's kind of the same concept, but this time we will measure the number need to harm. And it's defined as the number of patients who need to be exposed to a risk factor or to be treated with a particular medication for one patient to be harmed. So in this case, we are talking about adverse effects or harm related to the intervention that we are doing. So here we are talking how many patients will get the harm after our new interventions. So here we are not talking about prevention. Here we are talking about harm occurrence. So the higher the number of the measurements number need to harm, the lower the risk of the harm and the safer is the exposure. Because we will not get one harmful patient from a few numbers. No, we will get one harm to one patient after treating a lot of patients. So that makes it a better value to have a higher number in the number need to harm. And the opposite is correct. The lower the number need to harm, the higher the risk of the harm. These, concepts need to be clear because sometimes when you are taking an exam, they might give you one of the options of the multiple choices about this concept. Which answer is correct? The higher the number of the number need to harm, the better the outcome, or the opposite. So we need to understand it. That will make it easier to answer correct. Now let's see the calculation of the number need to harm. The number need to harm equals 1 over the attributable risk. And if you missed my video on the calculation of attributable risk, you can also review my playlist for medical statistics, and it's over there. But as a reminder, the attributable risk is the risk in intervention group minus the risk in control group, because it measures how much of this outcome happens due to the intervention, how much attributed to the intervention. So we simply subtract the intervention group and the control group. In terms of mathematical equations, the attributable risk equals A over A plus B minus C over C plus D. It's very important to be mindful when you put the equation, because if you compare it with our calculation for the number need to treat, which we use the absolute risk reduction, we put the control group first. Here, no, we put the intervention group first, and then we do the subtraction. And after that, we will discuss the example to make it clear and practical. This one says clinical trial is testing a new drug for a chronic condition. The 2x2 table data was collected from the randomized control trial, and it's given in the 2x2 table. So what's the number need to harm? And here is the 2x2 table. I want you to take a look at the labeling of the table. And here we have the adverse events when it's positive and when it's negative. Because remember, we are talking about harm. So in a new drug or a new intervention, we will be looking for a harm, which might be an adverse event. So this is the outcome in this condition. It's also very important to consider this labeling and to be very accurate when you label your 2x2 table so that your calculation will be correct. So let's do the math. We'll start with the intervention group. And as we see here, it's the risk in the intervention group equals 20 over 100, and the product is 0.2, which is 20%. For the control group, the same equation. And from this 2x2 table, it's 10 over 100, and the product is 0.1 or 10%. Now let's calculate our attributable risk. And the subtraction is 0.2 minus 0.1 equals 0.1. So the number need to harm would be 1 over 0.1, which is 10. So let's interpret this. The interpretation for this case will be for every 10 patients treated with the new medication, 1 additional patient will experience an adverse event compared to the placebo. So it's telling us how much harm will happen if we apply this new intervention at the population level. So for each 10 patients, there will be 1 patient will got the adverse event. And that's how we interpret the number need to harm. We have some clinical significance point we need to mention here, that the number need to harm facilitates our decision making, same as the number need to treat, because it allows us to choose between intervention, which one has less harm. That's very important. And as we said, the low number need to harm indicate high risk of harm to the patient. So we should consider the severity of any adverse event, and we have to be aware about whether to choose this intervention or not. The number need to harm can be used also to compare the severity of different treatments. not a new intervention, current medication or multiple medications we have, to compare between the safety of them. Also, we can use the number need to harm. These two measures are very important and very clinical oriented. And when you read an article, you might encounter them. So better to have the understanding of them, and it will make things more clear for you. I hope you enjoyed this presentation, and thank you so much.